So much. What an exciting talk and so many different opportunities and insights for those that are developing new drugs from the unique environment, the desert, of course, bioenvironment. It is now a pleasure to introduce Dr. Siegel.
Thank you. Sure. Let's see. Hi, for something completely different. First of all, I'd like to thank Amira for inviting me to talk. And she gave me a couple of interesting challenges. One challenge was to actually make a recommendation for action of something that we might be able to do and use, and then to talk a little bit about just a research project I have and how I'd like to see that happen. It was really fascinating this morning to have the opportunity to hear all the amazing research that's been done with regard to skin imaging, with regard to many other cardiac imaging, or cardiac applications. And one of the things that occurred to me was the importance of being able to have quantitative analysis for this information. And so what I'm going to propose is, in addition, we heard about a microbiology or sort of a microbe core that was here. We also heard a little bit about some of the really cool skin research that was done. I'm going to propose that we consider a core, an imaging core, specifically for here that would be able to do quantitative analysis. And I'd like to talk about one technology that I think would be really fascinating in order to be able to get some of that quantitative data. I had the opportunity to read through some of the literature that's been written on Dead Sea research in medicine. And one of the things that characterized it was some really interesting positive results, but I kept wanting to see more with regard to the numbers, more with regard to quantification. And one thing that occurs to me as a radiologist is that the skin seems to be one of the last frontiers with regard to imaging. I mean, I can image practically anything in the body with MR and CT. The one area that we really haven't done very much with regard to medical imaging is the skin itself. Now you might say, well, sure, the reason that we haven't is you can see the skin. But actually there's a tremendous amount of information with skin pathology that's actually under the surface. And we don't really have any really good technologies to be able to do that. Dermatologist friends would talk about dermoscopes, and we could talk a little bit about some technologies, but those are really in many ways have a lot of limitations. So let's talk a little bit about a technology that I think that might work out really well here. We've talked a lot about elastography and about elastic characteristics of the skin. Mira wants something to take away wrinkles, and we talked a little bit about increased cardiac compliance. Are there ways that we can actually look at elastic properties of the heart, of the skin, and of other areas of the body? So with regard to skin cancer, as you all may know, there's a tremendous number of patients who have skin cancer. In fact, skin cancer is more common than all the other cancers put together. And there's, in the US, about 67,000 cases of melanoma, about 1 million cases of basal cell carcinoma, 250,000 of squamous cell carcinoma. And what's really alarming is the incredible increase in skin cancer over the years. And this is, the last one's from 2010. There's actually been a significant increase in the incidence of melanoma since 2010, believe it or not. And so we're not really sure. I mean, some of it may be some of the sun tanning facilities, but we're not sure exactly why this incidence of melanoma and other skin cancers has gone up so precipitously. So I want to talk about a technology that's actually relatively inexpensive in comparison to MR, PET-CT, and some of the other modalities that we have in imaging called elastography. And what that does is it looks at the hardness. And so we can use ultrasound to be able to look at the hardness under the skin and compliance. We can do the same thing for thyroid nodules, for breast lesions, for liver lesions, and it's a really interesting technology. It's been used in the past for a number of different lesions, including musculoskeletal lesions, liver cancer, thyroid, and breast cancer, as I mentioned. It's completely non-invasive, and it's been used in many different areas. Elastography for the skin was first described in 2007, and there's a mechanism to be able to do quantitative analysis. And so we can actually come up with a quantitative number looking at the elastic property of skin. And so here's an example, and I'm not sure if I've got a pointer or not up here. I'm not going to try and touch the screen. Oh, I can actually, yeah, great. So if you take a look at this skin lesion.
Maybe turn the lights down on the front of the screen.
If so, I'm not, oh, great, thanks. Yeah, I hope that's helpful. And so if you take a look at this lesion, on a scale of really soft, this kind of red or orange, to really hard, this blue, you can see that this particular lesion in the skin, and going down pretty far, is blue. That would suggest that it's hard. Hard lesions are non-elastic and non-compressible. And so this is an example of a squamous cell carcinoma. And so this is a case that's positive for malignancy. Here's a second case. And if you go here, you can see that here's an example of a second lesion in the skin. You can see this is the skin surface, and you can see all the way down to the basement membrane. And at this point, right under the skin surface, you see this area that's really blue. And that blue, again, in comparison to the surrounding tissue, suggests that it's really hard. And so that this represents a basal cell carcinoma. If you take a look at this lesion, there's actually a relatively small ratio between the skin lesion itself, which you can see here in sort of maybe not as dark blue in comparison to the surrounding skin. And when you look at the ratio of those, it's relatively small. So this is a much softer, this is a lesion that is much closer to normal skin, and this is a seborrheic keratosis. And then here's another example of a lesion. This one is below the skin surface. It's relatively heterogeneous. We see areas that are hard and areas that are softer within this lesion. And that heterogeneous lesion is a keloid, benign. Here we have something, again, that looks relatively softer. It's got a lot of components that look kind of this yellow and orange within this lesion, but there are also some areas that are really very hard. You can see that depicted in this blue area. So what this represents is a skin lesion that's mixed. It's a pilar cyst. The areas of calcification are the really harder areas, but this is another benign lesion. So in a series of patients that we did, the results of our study were actually 100%. In other words, we were able to create a line between looking at elasticity or strain values, whereby every single benign skin lesion was less hard than a particular line that we drew, and every malignant lesion was higher. And so everybody has skin lesions, and one of the things that dermatologists do currently is we excise skin lesions. And what this study shows is there's the potential to be able to characterize those lesions in an extremely accurate way. Now, this was only done on somewhere around 60 to 70 patients or so. We want to extend the study. But what it demonstrates is, in this particular case, an extraordinarily promising modality for being able to tell benign versus malignant skin lesions. And what you can do is you can generalize this. So patients who've had psoriasis, patients who've had a number of different skin disorders that we've talked about, instead of just looking at the surface or waiting until a lesion's excised, we have the capability of being able to image them real time. Of all the imaging modalities that we have, one of the least expensive ones is ultrasound and ultrasound elastography. And wouldn't it be amazing to be able to have a system like that here, and so the patients who are undergoing experiments or undergoing research projects, to be able to image them in vivo over time, to see whether or not a treatment, when it is stopped, what the changes are within the skin, and being able to essentially quantify what those changes and what those differences are. And so being able to see all the way down to the basement membrane is really exciting. The studies we did were at a relatively low frequency. The frequency that we used was somewhere in the neighborhood of about 14 megahertz or so. And it turns out that you can continue to increase the frequency. As the frequency in ultrasound goes up, the resolution increases too. The thing about ultrasound is the higher the frequency, the better the resolution, but the less penetration you get. So with typical ultrasound studies that we do, we don't go up as high as 20 megahertz or 50 megahertz, traditionally with the ultrasound machines that exist today, because you can't penetrate very deep. But for the skin, when you only need to go down 4, 5, 6 millimeters or so, in general, it's the perfect tool. And so we're looking at ultrasound systems that are pushing the limits of what is currently used clinically in medicine, going to 20 megahertz, 40, 50 megahertz. And there's the potential to be able to get histologic level detail when you go to really high frequencies. Because of that, there's the potential to be able to actually see the histology without excising the lesion. There are patients who have multiple dysplastic nevi syndrome, for example, where there are many moles. Those patients, it's really difficult to tell when they have melanoma. But even for all sorts of different skin lesions, in patients who are getting radiation therapy, patients who have various types of dermatitis, all of them can be diagnosed using high-frequency ultrasound. What are some of the challenges? Well, one challenge is the curvature of the skin and the fact that our transducers tend to be relatively flat and straight, but there are transducers like these kind of hockey puck sort of shapes that get around some of that. Some other challenges are sometimes the tumor itself or the lesion is heterogeneous, and it's hard to know exactly where to sample the hardness or the tissue strain value. But overall, the applications are huge in many different ways, and I think it really would lend itself very nicely. So if an MRI scanner is $3 million, if a high-end CT scanner is $1 million to $2 million, ultrasound costs are down as low as about $2,000 for a basic ultrasound system and transducer. A system that would be able to do elastography at a high level might be $20,000 to $50,000, a tiny fraction of what one might use for other types of imaging. And one can use it, multi-purpose it. So we talked a little bit about arthritis and musculoskeletal applications, and I think ultrasound would be really perfect for that. So I think in conclusion, ultrasound is unique in its ability to provide depth, high resolution, functional imaging in vivo, and also be able to do that non-invasively. So again, my suggestion for discussion would be the potential to be able to create a quantitative imaging core that would be here that would allow the research center to be able to do real-time interactive experimentation. So thank you all very much.
Well, that's a wonderful recommendation.